What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my anatomy playlist. In previous videos, we talked about review of the anatomy of the head and neck, anatomy of the thorax, of the abdomen, of the pelvis, the perineum, the upper extremities, lower extremities, neuroanatomy, and even embryology. And in the last several videos, we talked about the carotid arteries, both the internal carotid and the external carotid artery. This external carotid artery has two famous terminal branches. This is the superficial temporal artery, but this is today's topic. This is the maxillary artery. Here's a quick history lesson that's going to help you tremendously. Did you know that the maxillary artery used to be called the internal maxillary artery, whereas the facial artery used to be known as the external maxillary artery? From this, you know that the facial artery is more external, whereas the maxillary artery is more internal. It's going to supply all kinds of internal structures. Click the like button, click the subscribe button before I massage both of your carotids simultaneously. Of course, I will never do this to you because I love you. This video is part of my anatomy playlist. Watch these videos in order. What happens if I massage both of your carotids at the same time? Well. Massaging both of the carotids at the same time is going to compress your baroreceptors in the carotid sinuses. And when you compress the baroreceptors, this signals to the brain that the blood pressure is too high. So what does the brain do? The brain does the opposite. The brain tries to lower your blood pressure to maintain homeostasis. So your brain is going to decrease your heart rate a lot. And the brain will also decrease vasoconstriction a lot, meaning it causes vasodilation instead. If you have severe bradycardia and extreme vasodilation, you might pass out, or worse, pass away from the baroreceptor reflex. That's why you should never ever massage both carotids at the same time. And if you are one of those people who has a sensitive carotid body, then maybe, just maybe, your sense of fashion should be devoid of high collars. And this is known as carotid sinus syndrome, when your carotid sinus is extremely sensitive. Please watch my video on the carotid arteries and the subclavian artery before watching this video. Let's use the Socratic method, questions and answers. Question: can you pause the video and label all of these structures? Let me know your answer in the comments. Are you ready for the answers? Let's go. This is the left atrium or the left auricle. This is the right atrium. This is the left ventricle. This is the right ventricle. The left ventricle ejects oxygenated blood into the aorta, E, whereas the right ventricle ejects deoxygenated blood into the pulmonary trunk, which will then branch into the right pulmonary artery and left pulmonary artery. The aortic arch has three main branches: brachiocephalic trunk, left common carotid artery, and left subclavian artery. In some people, there is a fourth branch coming out of the aortic arch. What is that fourth branch? If you know, comment below. This is the right atrium. It receives venous blood from three sites. One, from the superior vena cava, which drains the upper half of your body. Two, the inferior vena cava, which drains the lower half of your body. And three, from the coronary sinus, which drains the heart itself. The arteries that supply the heart are called coronary arteries, but the veins that drain the heart eventually become the coronary sinus, which drains into the right atrium. As you can see, this right atrium receives deoxygenated blood from all the main veins of the body, and that's why in physiology, the name of the pressure within the right atrium is the central venous pressure, i.e., you can think of the right atrium as the central vein of the body. And that is such an honor for a tiny chamber. We do this every time because repetition is the mother of pedagogy. The apex of the heart is formed by the left ventricle. The left ventricle has oxygenated blood. The left ventricle has a cavity and it has an outflow tract. The outflow tract is going to lead you to the aorta. Ascending aorta, aortic arch, descending thoracic aorta, pierce the diaphragm, or more accurately, pass behind the diaphragm at the level of T12 to enter into the abdomen and become the abdominal aorta by a verbal sleight of hand. The ascending aorta has a sinus, and this sinus will give me right coronary artery and left coronary artery. That's the ascending aorta. Then the aortic arch will give me brachiocephalic artery, left common carotid artery, left subclavian artery. Left ventricle again ejects oxygenated blood into the aorta. This is the ascending aorta. This is the aortic arch. This is the descending thoracic aorta. The ascending aorta has a sinus, which gives us the right coronary artery and the left coronary artery. The aortic arch has three main branches: brachiocephalic trunk, left common carotid artery, and left subclavian artery. Now I can see that I have a subclavian artery on the left, but where does the subclavian artery on the right come from? There you go. This is the ascending aorta, right coronary artery and left coronary artery. The left coronary artery will then divide into left anterior descending and left circumflex. But I digress. Back to the aortic arch. It has the brachiocephalic artery, it has the left common carotid and the left subclavian. The brachiocephalic artery itself will divide into right subclavian and right common carotid. This is the right vagus nerve. This is the left vagus nerve. The right vagus nerve, which is cranial nerve number 10, after descending that much, it forgot something. Oh, I forgot to give the recurrent laryngeal nerve. So we'll give the recurrent laryngeal nerve, which will loop around and below the right subclavian on the right side. But the left vagus is different. It also forgot the recurrent laryngeal, and then it remembered to give the recurrent laryngeal that will arch below the aortic arch, just near the ligamentum arteriosum, formerly ductus arteriosus. A ductus arteriosus is a duct between two arteries, the aorta and the pulmonary trunk. And the answer is the right subclavian artery is a branch of the brachiocephalic trunk, because the brachiocephalic trunk, which is the first branch of the aortic arch, is going to divide into a right subclavian artery for your arm and a right common carotid artery for your head. This is the left common carotid artery and this is the left subclavian artery. What's the name of this doozy nerve? If you know, comment below. How about that dorky nerve, which is a breath of fresh air, no pun intended? What's the name of that nerve? Comment below. Today's video is just a sample of the longer review on the anatomy of the head and my other videos on the anatomy of the neck review. You can find all of my review videos in a glorious playlist titled A 90 Minutes Quick Review, where you will find review videos for the anatomy of the head, review videos for the anatomy of the neck, review videos for the anatomy of the thorax, the abdomen, the pelvis and perineum, upper extremities, lower extremities, embryology, and neuroanatomy. Each one of these regions is reviewed in 3 videos. Part 1 is titled Quick Review, Part 2 is Ultimate Review, and Part 3 is Clinically Oriented Anatomy of that region. So there is Quick Review for the anatomy of the thorax, Ultimate Review of the anatomy of the thorax, and Clinically Oriented Anatomy of the thorax. If you can just watch these videos, you will know more anatomy than the vast majority of people who live on this planet. But wait, there is more. I have review videos for physiology, review videos for biochemistry, for molecular biology, genetics, pharmacology, pathology, and I cannot forget microbiology. There is a review video for general micro on the gram-positive bacteria, the gram-negative bacteria, the viruses, the fungi, and human parasitology. And I have review videos for internal medicine, 2 review videos for cardiology, 2 on neurology, 2 on pulmonology, endocrinology, hematology, oncology, immunology, rheumatology, nephrology, GI, dermatology, ophthalmology, ENT, infectious diseases, geriatrics, and EKG. And a review video for emergency medicine. If you want me to make review videos on these topics, please let me know in the comments. You'll find several review videos for surgery, as well as pediatrics and obstetrics and gynecology. All of them are in my playlist titled A 90 Minutes Quick Review. And back to the video. Here's the aortic arch, brachiocephalic artery, left common carotid, left subclavian. Brachiocephalic will then give me right subclavian and right common carotid. Right common carotid will become external carotid and internal carotid. That's on the right side. On the left side, the left common carotid will also divide into left internal carotid and left external carotid. The internal carotids are for the brain. The external carotids are for the face, basically. At the bifurcation of the common carotid into external and internal, we see the carotid sinus. Carotid sinus contains baroreceptors. The carotid body contains chemoreceptors. Both the baroreceptors and the chemoreceptors in the carotid sinus are supplied by the glossopharyngeal nerve, which is the 9th cranial nerve. However, the chemoreceptors and baroreceptors in the aortic arch are supplied by vagus, because the vagus nerve comes close to the aortic arch before it remembers to give its recurrent laryngeal nerve. The brachiocephalic artery will then give me right subclavian and right common carotid. The common carotid will give me external carotid and internal carotid. The left common carotid will also give me internal and external carotids. All of this fancy schmancy area is your neck. This bone above is the mandible. This is the base of the skull, particularly the basilar part of the occipital bone. This is the sternum, or the manubrium sterni, and this is the clavicle, this is the scapula. What was the name of the cranial nerve that emerged between the styloid process and the mastoid process? You can learn more about the anatomy of the head and neck here. Here is an outline of all of the topics covered in my review videos on the anatomy of the head and on the anatomy of the neck. Today we're talking about the subclavian artery. The previous video was on the carotid arteries. The next video will cover the maxillary artery, and then we'll talk about the thyroid arteries, and then we'll talk about the neck veins. We're gonna go for the jugular. This is the trapezius. This is the midline of the neck. This is the sternocleidomastoid. Behind the sternocleidomastoid, there's the posterior triangle. In front of it, there's the anterior triangle of the neck. This is the omohyoid muscle, from the scapula to the hyoid bone. It has a dirty intermediate tendon that attaches to the clavicle by a double sling. Connective tissue wraps around connective tissue, back to the clavicle. This is the brachiocephalic artery. This is right subclavian. This is right common carotid. The right common carotid will give me right internal carotid for the brain and right external carotid for the face. The internal carotid has 5 branches. The 2 most important ones are anterior cerebral and middle cerebral. The external carotid artery has 8 branches. I just want you to remember 2 for now. 1 internal, 1 external. The internal one is the deeper one. That's the maxillary artery. The more superficial one is the facial artery. This is the facial artery. From the subclavian artery, we see this vertebral artery. You see it passes through the foramina transversarium of C6, C5, C4, C3, C2, and C1. But it does not pass through C7's transverse foramen. The anterior circulation of the brain is supplied by the internal carotid, whereas the posterior circulation of the brain is supplied by the vertebral artery. 2 vertebral arteries join forces to give me this basilar artery. The basilar artery has many branches. The final ones are posterior cerebral arteries. So now we know where the anterior cerebral, middle cerebral, and posterior cerebral came from. ACA and MCA from the internal carotid, PCA from the basilar, which came from the vertebral. Why do we call the basilar artery basilar? Because it runs on the basis pontis, or the base of the pons. Also because it's located at the base of the brain. This is the brachiocephalic trunk. This is right common carotid, and this is right subclavian. The subclavian artery has 3 parts. First part, or S1, second part, or S2, third part, or S3. The first part is medial to the scalenus anterior muscle. The second part runs behind or deep to the scalenus anterior muscle. The third part is lateral to the anterior scalene muscle. Back to the common carotid artery. It will give us 2 terminal branches. External carotid artery for the face and internal carotid artery for the brain. Here's the first part of subclavian artery. This is the vertebral artery. It runs through the transverse foramina of C1, C2, C3, C4, C5, C6, but not C7. It ends up by entering the foramen magnum, uniting with the vertebral artery on the other side to form the basilar artery, which runs anterior to basis pontis. The basilar artery ends up by giving us 2 posterior cerebral arteries. Back to the common carotid artery. This is brachiocephalic, this is subclavian, this is common carotid. Common carotid will give me internal carotid for the brain, which enters through the carotid canal. It bends forwards and up, disrespecting itself and disrespecting the cavernous sinus. But it gets disrespected by sympathetic nerves, piggybacking on this internal carotid artery until they give us the deep petrosal nerve. After that, these sympathetic fibers will piggyback onto ophthalmic artery, which is a branch of internal carotid, until they reach the eye. What are the 8 branches of the external carotid? Superior thyroid artery, lingual artery, facial artery. All of these are from the anterior aspect. From the posterior aspect, we have occipital artery and posterior auricular artery. From the medial aspect, or the inner aspect of the external carotid, we have the ascending pharyngeal artery for the pharynx. The 2 terminal branches of the external carotid are the maxillary artery and the superficial temporal artery. Don't forget that the superior thyroid artery is a branch of external carotid, whereas the inferior thyroid artery is a branch of the thyrocervical trunk, which is a branch of the first part of subclavian artery. This is the external carotid artery. This is superior thyroid artery. This is lingual artery, which is very tortuous because your tongue moves a lot because you talk too much. And this is facial artery. Also tortuous because you're gonna turn your head to the left, to the right, etc. These are the branches of the anterior aspect. Then we have occipital artery and posterior auricular artery from the posterior aspect of the external carotid. Not shown here is the ascending pharyngeal artery. The 2 terminal branches are the maxillary artery and the superficial temporal. This is external carotid artery. It has 8 branches. What are the 2 terminal branches? Maxillary artery and superficial temporal artery. This is the external carotid artery. This is the maxillary artery, and this is the superficial temporal artery, the 2 terminal branches of the external carotid. The maxillary artery is said to have 3 parts: first part, second part, and third part. It ends by becoming something else. It becomes infraorbital artery, which enters the orbit through the infraorbital fissure or inferior orbital fissure, accompanied by the infraorbital nerve, which is a continuation of the maxillary nerve, V2. This infraorbital artery is gonna end up by giving us palpebral branches, nasal branches, and labial branches. It emerges from the infraorbital foramen. What are the branches of the maxillary artery? The first part of the maxillary artery has 5 branches. The second part will give us 5 branches. The third part will give us 5 or 6 branches. But to keep it simple, let's just talk about 5, 5, and 5. This is the external carotid artery. The 2 terminal branches are superficial temporal and maxillary. The maxillary has 3 parts: first part, second part, and third part. The 5 branches of the first part include deep auricular artery, anterior tympanic artery, middle meningeal artery, which enters the skull through foramen spinosum, accessory meningeal artery, which enters through the foramen ovale. And we shall not forget the inferior alveolar artery, which accompanies the inferior alveolar nerve. Together, the inferior alveolar artery and inferior alveolar nerve will enter through the mandibular foramen on the inner aspect of the mandible. The inferior alveolar nerve will supply the mylohyoid muscle. The inferior alveolar artery does the same. It supplies the mylohyoid muscle. For the pros, the deep auricular artery is going to enter through the external auditory meatus, whereas the anterior tympanic is going to enter the middle ear cavity via the squamotympanic fissure, also known as petrotympanic fissure. These are the 5 branches of the first part of the maxillary artery: deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar artery, which will enter into the mandibular foramen accompanied by the inferior alveolar nerve. Next, second part of the maxillary artery has 5 branches. Pterygoid branches for the medial and lateral pterygoid muscles. Deep temporal branches, posterior and anterior, for the temporalis muscle. Masseteric for the masseter muscle. Buccinator for the buccinator muscle. This buccinator artery is sometimes called buccal artery. The buccal artery of the maxillary accompanies the buccal branch of mandibular nerve. Both of them are going to reach the buccinator muscle. Next, the third part of the maxillary artery. Look at this. That was inferior alveolar. But look at this. Superior alveolar. Which one? Posterior superior alveolar. Next, the maxillary artery ends up by becoming infraorbital artery, which will give us palpebral branches, nasal branches, labial branches, anterior superior dental artery, and orbital branches. Next, sphenopalatine artery, which is going to reach your nose via the sphenopalatine foramen. Next, the artery of the pterygoid canal, which is going to reach your nasopharynx, accompanied by nerve of pterygoid canal, also known as the Vidian nerve. Next, pharyngeal branch for the pharynx. Then a bunch of descending palatine arteries, including greater palatine artery and 2 or 3 lesser palatine arteries. The greater palatine artery will enter through the greater palatine foramen, whereas the lesser palatine arteries will pass through the lesser palatine foramina. And these are the branches of the maxillary artery. Please take your time to pause and review. By now, you should know everything about the foramina of the skull and the structures that pass through them. Don't forget that the carotid canal is for the internal carotid artery, the jugular foramen is for the internal jugular vein and other nerves, foramen magnum is for the 2 vertebral arteries, and the spinal arteries, 1 anterior and 2 posterior spinal arteries. The foramen spinosum is for the middle meningeal artery. Don't forget that the philosopher Baruch de Spinoza is an MMA fighter. MMA fighter, middle meningeal artery, is foramen spinosum. The optic canal contains the ophthalmic artery, which is a branch of the internal carotid artery. Now please re-watch the last 45 seconds again before we dig deeper. The maxillary artery terminated by turning into the inferior orbital artery, which passes through the inferior orbital fissure, or the infraorbital canal, accompanied by the infraorbital nerve, which is a continuation of the maxillary nerve, or V2. So the continuation of the maxillary nerve with the continuation of the maxillary artery, both infraorbitals pass through the infraorbital canal. Next, the middle meningeal artery, which is a branch of the maxillary, passes through the foramen spinosum. The philosopher Baruch de Spinoza is an MMA fighter. Middle meningeal artery through the foramen spinosum. The middle meningeal artery has 2 main branches, anterior and posterior. Both of them supply the skull bones from the inside, the dura mater, the trigeminal ganglion, the tensor tympani muscle, and more. That's it for the middle meningeal artery, which runs through the foramen spinosum, which is here and here. But how about the accessory meningeal artery? It passes through the foramen ovale, here and here. The foramen ovale is very close to the foramen spinosum, as you can see. Next, inferior alveolar artery, which is another branch of the maxillary artery, enters the mandibular foramen in the mandible. Next, the deep auricular artery enters through the external auditory meatus to enter to the external ear, whereas the anterior tympanic artery, another branch of the maxillary, enters the middle ear through the squamotympanic fissure, also known as pterygotympanic fissure. Here is the pterygotympanic fissure, very close to the external auditory meatus, as you see here. The same maxillary artery is also going to give us greater palatine artery and a bunch of lesser palatine arteries. The greater palatine artery, as you can imagine, is going to pass through the greater palatine foramen, which is here, whereas the lesser palatine arteries will pass through the lesser palatine foramina, which are here. Another branch of the maxillary artery is the sphenopalatine artery, which passes through the sphenopalatine foramen. This is the ophthalmic artery, which is a branch of the internal carotid artery. Not external, but internal carotid artery. This ophthalmic artery is going to give me a very important artery, which is supraorbital artery. Not to be confused with the infraorbital artery. As you see, the supraorbital artery is a branch of the ophthalmic, which is a branch of the internal carotid. Whereas the infraorbital artery is the termination or the continuation of the maxillary artery, which is a branch of the external, not the internal carotid artery. So, supraorbital from the ophthalmic from the internal carotid, whereas infraorbital is from the maxillary from the external carotid. I've talked about the ophthalmic artery in more detail in my video on the carotid arteries. Arterial supply of the scalp, supraorbital and supratrochlear. Don't forget that the supratrochlear is more medial. Both of them are branches of the ophthalmic artery, which is a branch of the internal carotid. And the superficial temporal, posterior auricular, and occipital arteries. All 3 are branches of the external carotid artery. The face is supplied by facial artery and by branches of superficial temporal as well. The nose is supplied by anterior and posterior ethmoidal arteries. sphenopalatine artery and greater palatine artery. And there's also a septal artery here, which came from superior labial, which came from facial. The anterior and posterior ethmoidal arteries are branches of the ophthalmic artery, which is a branch of the internal carotid artery, whereas the sphenopalatine artery and the greater palatine artery are both branches of the maxillary artery of the external carotid artery. To learn about the blood supply of the thyroid gland and the blood supply of the pharynx and the larynx, please refer to my video titled Thyroid Arteries, which you can find in this anatomy playlist. We talked about arteries a lot, but how about the veins of the neck? We'll talk about them in a separate video titled Neck Veins in this anatomy playlist. Or you can watch my video on Anatomy of the Neck Ultimate Review to learn more. Before you leave this video, I want you to sit down, focus, and try to answer the following questions. Where can I find each of these foramina on the skull? And what are the structures that pass through each one of these? Please pause and review. This is very important. After mastering anatomy, you can master surgery by downloading my surgery high yields course at medicosisperfectionalis.com. I help you learn, understand, and pass exams. I have many courses on my website. Each one comes with videos, notes, and cases. And here's another subject that drives students nuts: antibiotics pharmacology. You can download my course on antibiotics at medicosisperfectionalis.com. It comes with videos, notes, and cases, as well as a mind map to help you visualize and memorize these medications. This course will teach you about antibacterials, antivirals, antifungals, and antiparasitic medications. Download it today at medicosisperfectionalis.com. If you find these videos to be helpful, please consider supporting my channel by buying me a coffee. Go to buymeacoffee.com/medicosis. There are more than 750 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.